everyone, I'm Jane, and this is the CareSmartz360 Bulletin. Tonight's top healthcare policy update comes from New York, where the Department of Health has issued a Dear Administrator letter detailing updated and streamlined policies for Administrative Licensure Amendments for licensed home care services agencies with the guidance effective immediately. ALAs now come with a key policy shift, a stricter needs analysis for expanding into new counties. The department will approve an ALA to add a county only if there is a demonstrated need, defined as fewer than 5 LHCSAs actively serving patients in that county, which means that the LHCSA has a plan of care in place for at least one patient receiving services at home. If there are 5 or more LHCSAs actively serving patients in the county, the expansion request will not be approved, with certain exclusions for amendments that exclusively serve within the new county for programs like assisted living programs, the program of all-inclusivity care for the elderly, the nurse-family partnership, or continuing care retirement community. The department has not yet stated whether these new requirements will apply to ALAs submitted before the August 8th effective date. In terms of process, ALAs will now be reviewed and approved by the DoH Bureau of Home and Community-Based Services Licensing Unit, marking a shift from the prior practice of submitting ALAs via email to the applicable regional office. Some requests, such as those to close a site or surrender a license, will require notice to the regional office. Agencies must submit a written and signed request on official letterhead or a letter from counsel or a consultant on behalf of the LHCSA to a new email address, and this submission must be accompanied by Attachment A. LHCSA Administrative Licensure Amendment Request Checklist, along with all required supporting information and documentation as noted in Attachment A. The update also notes that DoH has not yet clarified how these requirements will apply to ALAs filed before August 8, 2025, and Holland & Knight is seeking further guidance on retroactive application to pending applications, some of which have been awaiting action for more than a year. As DoH continues to provide guidance, legal practitioners and LHCSAs will need to monitor for additional clarifications on the retroactive application, the expansion need threshold, and how the new process interacts with existing approvals. That's all for today in the CareSmartz360 Bulletin. See you soon. Until then, have a great day.